Okay, so now we're moving to agenda item number 3, presentation concerning the results of the community survey. Ms. Dunaway?
Thank you. So I've mentioned a few times in this meeting, and some of you hopefully received the survey that we did on the last referendum, predominantly for the fact that we were created after that vote was taken. And I very much wished I could have done an exit poll to get sentiment. So we decided to do a survey, and I wanted to enlist a professional in doing it. So Bob Walker has, how many years have you been?
Too many to count, 30 plus.
Okay, 30 plus years. We've worked together a couple of times on survey research, and I asked him to execute this survey for us. So I'm going to let you introduce yourself a little bit more and then take it away.
Okay. Should I hit the lights? Or?
I will.
Okay.
Thank you.
Thanks, Pamela. Let me slide over here and not strangle myself on the safety of my cable. Yeah, I'm Bob Walker. I run a marketing, research, and consulting firm called Surveys and Forecasts. It's been in business for about 31 years now. I do a wide variety of research projects for all kinds of clients. This was certainly an interesting one for me because I'm not usually involved in local issues, so it was a lot of fun. But if you have any questions along the way, I guess we'll save those maybe till the end, as opposed to, like throughout is probably just easier. But this was a professionally designed survey. It's the typical of the kinds of studies I would execute for a client. So I'm happy to be here, and I'll walk you through it. So let me put it into presentation mode here. All right. So as Pamela was saying, ordinarily you could maybe do an exit poll, but we were fortunate enough to have the resources and the information to be able to do an actual survey of residents in town, and I'll go into some of the details of the sample that we used. But I feel very good about it in terms of process and the kinds of data that we got back. So I'll walk you through that in a little bit more detail. Just to remind everyone what we're doing and why we did it, just on the left-hand panel in terms of background, in November of 25, we had a referendum here in Ridgefield for the Combined Emergency Services Command Center. It was a $77 million bond issue that was voted down, and that in turn left the project without a real clear path forward. So my firm was commissioned to conduct a formal survey of registered voters to assess sentiment and identify concerns ahead of any future proposal. We had 6 research objectives. I'll go through them one at a time. I apologize for reading, but it's best if we go through it, just procedurally. Number 1 was to understand attitudes towards the 25 proposal and how they've changed or evolved. Number 2, to measure registered voter support for a Combined Emergency Services Command Center, which I'll get into in terms of the actual questions that we asked. To identify the concerns driving opposition, cost, location, scope, communication. We looked at those, and we are able to prioritize those in with a little bit more granularity for you. Number 4, to assess which decision factors matter most to voters when considering a future referendum, and I'll go into that a little bit in terms of how we did that. And then profiling. We wanted to profile by subgroup, age, voting history, future voting intent, how long people have lived in the town. We also asked an income question, just to be able to provide some guidance on communications. And last was to develop some actionable guidance for positioning and messaging, so that if a revised proposal comes along, it can be done perhaps more effectively and more persuasively. So those were our overall research objectives for this study. Who did we talk to? That's the sample universe, and we'll go through section by section. This is on the research method itself. We pulled a sample from Ridgefield Civic Notification System. We started with 8,637 residential records who opted in to receive general government or public safety announcements, those like reverse 911 messages and things like that. But that also included phone numbers, it included email addresses, it included cell phone SMS messages. We duplicated that because we had multiple databases that we drew from. We went through that, we filtered on email address, first name, last name, and we ended up with about 3,600 invitations that were sent in March, beginning of March. We received almost 1,000 responses in return, about a 27% response rate. But we further filtered that down to just look at registered voters, because some were not registered voters. Some did not complete the entire survey. We limited it to registered voters and those who answered all of our questions. We didn't do a partial analysis of the data. We wanted to make sure we had everyone answering all of the questions. We didn't lose a lot of people. We lost some. But that was the number, roughly 800, which is a very healthy sample, statistically and otherwise, for representing what we got. The survey itself, in terms of what we did, invitations were sent out via the town's administrative office system. This email address is already whitelisted. If we were to have sent it out under our domain, it probably would have ended up in the spam folder, so this was a definite benefit. The survey was brief. It was about 4 minutes end to end to complete. And as I alluded to in the objectives, the topics included whether they were residents, whether they are registered to vote, their prior voting behavior, their future voting intent, their sentiment. We asked them their open-ended rationale for why they felt the way that they do in terms of future voting intent. We asked some attitudinal statements, which were agreement statements, 5-point agreement statements. We also asked importance ratings, 7 items on importance. And then just for profiling, as I mentioned before, we asked how long they had lived in town, their age, and volunteer if they wanted for their income. Our analysis was fairly comprehensive. We had probably 15 to 20 different variables that we looked across in terms of trying to understand overall sentiment. We focused on who previously supported versus opposed the referendum, future intent, and some of the demographic questions that I mentioned earlier. We also coded all of the open-ended responses into themes, and then in turn built subcategories for those themes, and we'll report on that. Any percentages that you see in this report are vertical column percentages. I'm not percentaging anything horizontally. There's no special magic there. I just wanted you to know that that's how the calculations are made. Okay, so we know that in terms of limitations and some caveats, I'm obligated to put that out here. Respondents are part of the town's existing notification system. So this introduces a little self-selection component because respondents are by definition engaged and more involved in town activities. They opted into municipal communication. So the population is likely to be more aware of the proposal than the general Ridgefield electorate. But that doesn't necessarily imply a bias one way or the other. It just means that they're more engaged. I would say that while this is a very large sample and you should feel good about it, results should still be used to generally inform future decision making. It's not a projectable probability sample. It's off of the lists that we had available. I feel very good about it, but keep that in mind. Continuing on the method aspect of the study, we had 6 different areas. One was the eligibility set of questions, making sure that they were a registered voter, but whether they owned or rent a residence, whether they were a full or part-time resident. Number 2 on the right, their voting history, whether they voted at all and how did they vote. We did offer a no preference response to that question, by the way, and we didn't get a lot of people in there, but we did give people an out if they were uncomfortable answering that question. Number 3, the current position and sentiment questions, which were voting intent if the referendum were held today. Overall sentiment is more of a general attitude, positive or negative, towards the idea of the combined facility. And we asked the open-ended questions that I mentioned earlier regarding why they gave us that answer. I mentioned the attitudinal questions, so we asked statements really about the facility condition, whether it was adequate, the value of a combined operations center, the impact on public safety, and then also perceptions on property value and the reaction to a possible tax increase as another statement. So that was the 4th area. The decision factors were a series of statements based on how important you think these different things are to you in making a decision about this issue. One was the importance of total cost, site cost, personal tax impact, location and traffic, and then responsiveness in terms of coordination for emergencies and response time. And then the last were the profile questions I mentioned before, how long they've been a resident, their age, and their income. So even with 13 or 14 questions, we actually managed to cover quite a bit comprehensively in terms of this issue. So let's get into some of the characteristics pretty clear who we were talking to. Overwhelmingly, they are owners, homeowners, and they live year-round in the town. So keep that in the back of your mind. We're not looking at apartment dwellers. We're looking at homeowners who've lived in the town, have lived in the town as full-time residents, and also in terms of like longevity, etc. On the pie chart to the left, we asked a question about how many years they've lived in the town of Ridgefield. While it's not a super skew, like it's not 50% or 60%, we've got a third of the sample have lived in town for 30 years or more. So keep that in mind as you look at the data. And then on income, which is the blue shaded area to the right, the majority of respondents are certainly in the 100K plus, and we've got 45% of survey respondents who have household incomes of 200K or more. And then you've got about 30% who are prefer not to answer. And historically in the work that I've done in survey research, that tends to skew to the higher income population, but you are looking at obviously a very high income profile for this sample. One of the things that Pamela and I had talked about is, how representative is this sample relative to the profile that we know voted in the November 25 referendum. And we were able to look at age. We were not how they voted necessarily, but who voted in terms of their age distribution. So in the table to the left are the age bands that we used in the survey and the proportion in our sample versus the voter file. And for the most part, you see very strong alignment across the middle core bands, 30 to 59-year-old age bands. We're a little bit underrepresented in the 18 to 29-year-old age group, roughly 4.3% in the voter file versus less than 0.5% in the survey sample file. And conversely, we've got a little bit more representation in 60 to 79-year-olds than we do in the voter file. But I think on balance, it really is pretty close. 4 or 5% here or there. Absolutely, there are some variations, but I was quite pleased that this came in as closely to the actual profile data that we had access to. So again, if you think about the age composition, and we looked at some of the previous questions, they line up pretty well, and I'll show you one more, which is really the critical one that I think we're here to talk about today, which is the actual vote itself. So based on the data that I have, 39%, according to what I looked at, was favorable, voted to support the referendum back in November of 25. We asked the question, how likely would you be to vote for this issue today if the referendum were held again? 35% would be definitely or probably would vote for it today. So again, those are not exactly the same, but they're reasonably close to what was actually happening back in November. The other part, because we were able to ask this as a sort of scale question, we have a middle box, which is not sure or it depends. 43% are on the fence in terms of what they would decide to do if it were held again today. And that's the group that in particular I'd like to focus on a little bit as I make my remarks tonight. So we have the age distribution, we have the voting history, and we have the future voting intent, which I think gives us a pretty good handle on the sample being somewhat close, if not very close, to what we experienced back in November in terms of representative. Again, it's not projectable, but it is, I think, quite close in terms of what we're looking at. Here's that same question, the 35% who would vote yes by all 5 option categories. So 35% would vote yes, those are the top 2, and there's a little rounding error, which is why it's 34% versus 35%, but that's immaterial really. The 43% who are undecided, and 22% who would vote no, based on a question if you were to vote today. So the key finding really here is that the quest for the facility, the new public safety facilities, isn't necessarily lost. It's simply not yet persuasive enough. You've got certainly 22% firmly opposed, but you've got this big block in the center who are undecided or are not sure. Translation, in my opinion, is not enough information to make an informed decision just yet. So the last bullet that I've got here on the lower right, you probably can't read it from where you're sitting, but it says voters aren't opposed, they're unconvinced. This is a persuasion problem, not necessarily a rejection problem. I mentioned before that we asked a series of agree, disagree statements, and these are the ones that we asked for this particular sample. This is an unusual result because typically we see kind of an easy graduated distribution of responses, but here we see a very clear pattern. This is of the total sample, what percent agree completely or somewhat with this statement. So 82% of the sample agree that Ridgefield's police and fire department facilities are outdated. So there's really very little disagreement on this issue. On the additional ones, Ridgefield would benefit from combining police, fire, dispatch, and volunteer operations. Combined public safety facility will improve public safety. I support a tax increase. I believe that an updated public safety facility will improve property values. Those are all in the, let's call them 40 to 45% range, but half of the level of the general agreement that the facilities are outdated. We also asked the statement, which is the bottom one, which I prefer 2 separate buildings for police and fire even if the cost is higher. That was really to tease out whether people were focused, I don't want to disconnect my presentation here. People were focused on the 2 buildings versus 1 building or the cost. So people aren't hung up on the 1 or 2 buildings. That's not the issue. It's that the facilities are outdated. Okay, that's the real core issue here. This is a little busy, I apologize, but we looked at the top 2 on the scale I showed you, that 35%, that definitely probably would vote yes in blue. The people who are unsure, that 43% in the middle, in the orange, and those that were probably or would definitely vote no, which was that 22% I showed you before. So you can clearly see even among those that are opposed, a majority still agree, 64%, that's that top cluster of numbers. 64% of the no's agree that the facilities are outdated. So again, there's not a lot of disagreement on that issue. The top 2 box definitely probably would vote for it today, and the neutrals are very close in terms of their overwhelming desire, or not desire, that's the wrong way to say it, the agreement that the facilities are outdated, but even the no's are coming in at 2/3 almost, agreeing with that statement. But if you look at the rest of these statements, you really do see them distill out quite dramatically, which is that the people who are positive towards the referendum, if it were held again today, are overwhelmingly in agreement on these other benefits that I'm listing up here. And the neutral group and the no's are much less convinced. So the overarching agreement is clear. The agreement on some of these, we'll call them secondary items, is less uniform. We also asked an open-ended question. Please briefly explain the main reasons for your position regarding a combined police and fire emergency services command center. So these are open-ended comments. This isn't a series of statements I asked them to rate. These are open-ended comments that we grouped together by common theme. And these are the comments that were voluntarily provided, not prompted by a question, but voluntarily provided. The cost-related comments were 60% of the sample overall. The need for the facility was 32%, location 24%, combined facility concept, positive comments about the combined facility was 16%, et cetera, down the list. So on an unprompted basis, respondents to the survey were mentioning cost as the #1 item. Again, if we look at the 3 groups, those that were positive towards the referendum, neutral or unsure, or would definitely vote no, clearly the neutrals and those that would vote no are heavily commenting on the cost component. And to a lesser extent on the facility need. Those that are positive to the idea of voting for the referendum today, much higher percentage of them are making comments about the need for the facility, and those that are opposed are focusing on the cost component. The location is another area, but it doesn't really come up quite as high in terms of the open-ended comments, but those are a little bit higher for the neutrals and the negatives. And for the rest, for the most part, They're very similar. The design scope comments are a little bit higher for those who are negative to the referendum if it were held today. But I think, you can generally see the pattern that it's bifurcating between cost on the one side and the demonstration of the need on the other. We looked at the likelihood of voting positively or negatively by age. And one of the things that popped out is that the 40 to 59-year-old age cohort represents perhaps your greatest persuasion challenge. They combine the lowest definite yes percentages with the largest undecided percentages. And in kind of going into this, I thought that this pattern might skew a little older, but it's really, I think, skewing more towards mid-age group, probably working, kids in college, lots of expenses. I'm just hypothesizing here, but I'm just sort of talking out loud that this age profile is when expenses really hit the household the hardest, probably for many of them. So it's not skewing quite the way I expected it to when I went into this. Yeah, so, and the other part, which is kind of the flip of that, my eyeglasses are betraying me right now, is that 60 to 79-year-olds are actually quite a bit more positive towards the referendum than I would have expected. So it's a little bit in the inverse of what I was expecting to see. I apologize, this is a bit of an eye chart, but I wanted to look at years in Ridgefield, and I also wanted to look at income. And I'll take income on the right. It's really not a lot of difference by income. Surprisingly, I would have expected some skews on income in terms of favorability towards the referendum, but we don't see that. So income is not a factor. The only thing that is somewhat of a factor, and it's modest, is are those who have been in town for 30 years or more are more positive. And those that have been in town a little bit less in terms of tenure are a little bit less positive, and a little bit more on the sort of the unsure category in particularly on the in the 11 to 20-year-old, 20 years residency group, not 11 to 20-year-old. We only interviewed 18 plus. Okay. So another area that we talked to respondents about was how important are some of these, the items that you see on the screen, how important are these factors in your decision to vote either in favor of or in opposition to a referendum on a new facility? And you can see overwhelmingly project costs are the #1 factor. Total project cost or cost of the site, statistically the cost of the site is a little bit less, but they're both in the cost area. Shorter emergency response times, still fairly high, but much lower than the cost component. My personal tax impact, about 3/4, a little bit less. Improved coordination for emergency services, 2/3. And then traffic and location are the least important in formulating an opinion. So it's a contest between responsiveness and services versus cost. That's really how I would view this. And when we look at the probability of voting in favor versus probability of voting no, you see that exact pattern in the box. So the total project costs, in terms of importance, are much less important to those who are favorable, who would vote for the referendum if it were held today. Those are the blue bars. But those who are positive towards the referendum are much more focused on shorter emergency response times and improved emergency coordination. That's the 93% and the 91% I've got highlighted in green. And then on the flip side, the unsures and the group that would vote no are very much in sync here. Total project costs are more important to them. The cost of the site is much more important to them. And their personal tax impact is much more important to them, especially for the no's. Traffic impact, location, they were low overall, and they're low regardless of how your propensity to vote might be. So clearly it's bifurcating on cost versus emergency response time and emergency responsiveness. So, what does the data suggest? And that's the data portion of the presentation. That's really more now for sort of summary and then some discussion. Number one, the shared premise is the starting point. 82% of residents agree that the current facilities are outdated. And that was really true regardless of voting propensity, even though it was a little bit lower for the no's. The only position that crosses every voter segment, as I mentioned, the data suggests that this is common ground where any future conversation with voters should begin. Number two, cost communication will be the determining factor. Cost is cited by 60% overall and 74% of opponents. The data suggests that general references to project costs are less effective than specific figures, total bond amount, annual household tax impact, and the long-term cost of inaction. Number three, location concerns remain unresolved. 24% of residents cite location as a factor. The data suggests that site selection rationale, traffic considerations, and construction details warrant some more direct communication. It's not like it's not important, it's certainly lower in terms of cost versus emergency responsiveness, but it does need to be addressed. This is, for me personally, this is the biggest focal area for the study. Undecided voters. They will respond to outcomes. The 43% undecided segment rates shorter response times and improved coordination as important at 73% and 67%. Respectively, the data suggests that this group is more receptive to performance outcomes than to the facility concept itself. And that's, in other words, talking about the facility as sort of a monolithic thing is not as persuasive as talking about the benefits that would come from that for this group. Process concerns represent a credibility gap. This is from the open-ended data. If you'll recall, we had 14% who cited poor communication or lack of transparency on the open-ended questions that we asked, one question that we asked. The data suggests that visible corrective steps, independent validation, resident input, feedback mechanisms, those could meaningfully reduce this resistance before the next vote. And last, peer outreach may reach audiences that official messaging cannot. We saw that, interestingly enough, the older age groups were actually more, and longer tenured residents were more positive towards this concept than were other groups. So the long tenured residents, the 30+ years, show the highest support of any tenure group. The data suggests that peer engagement could be more effective than broadcast communication in reaching the undecided 40 to 59 cohort. So I think that's a wrap in terms of the presentation of the results. I think that there's a lot of work that can be done here based on this data to help better communicate the proposition to voters, to residents. I also think that focusing on the benefits of the facility have been somewhat underplayed based on what I'm seeing in this data, and that is certainly another opportunity. And then the last is the sort of point number 4. The undecided voters, that's really your swing group in terms of who will tilt more in favor and who will continue to oppose. Trying to understand them a little bit better, which we did here, I think is really important. But I think they're looking for the rational story, as opposed to, here's a new facility, we need it, please vote for it, as opposed to, please explain why you need it and what the benefits will be, etc. So with that, I'll turn it back to you.
Thank you. And 2 brief things. First off, I'd like to commend you for outstanding work.
Oh,
and I mean, really, this is phenomenal, top-rate work. I worked at a consumer products company, and this is like really, really good.
So did I.
We have worked at the same time.
We might have.
Right. And Pamela, to Ms. Dunaway, kudos to your leadership and your vision for this.
Very much so.
Very much. I mean, outstanding. The need, you saw it before anyone else did, so kudos. And with that, I think, Pamela, it'd be great if you led us in the discussions and Q&A around this.
Yeah, and one thing, thank you, and thank you very much, Bob. It's always great to work with you, and it was wonderful to work on this with you. I helped formulate where we wanted to go, and you made it work. The presentation will be made public on the town website in that documents section, just so everybody knows, so everybody can see this. I think as we've gone through this process and we've learned, I think it's solidifying what we have learned, which is, and what we've intended to do, which was to bring the public along the journey with us to wherever we're headed. I was heartened to see that there seems to be agreement that we need to do something, whatever the something is. And I was heartened to see that even some of the constituency that was against the last referendum is open to rethinking something in the future and thinking about it with fresh eyes, with a fresh mind. So I found that also a very big positive. And I did think it came through very clear that we need to be specific, like we talked about last week with scenarios, pros and cons of the scenarios, so that everybody can see those, you know, as we line those up, even if they're broad stroke. I'll open it to the floor so we don't take up too much time, and then we'll see if anybody wants to. Are there any questions on it? Any comments?
I have a question.
Okay.
So, commend excellent work, fantastic. The 35, 43, 22, which was the percent yeses, undecided,
Yes.
and noes, that seemed to drive a lot of the analysis that followed. So I want to go back to the 35, 43, 22 and understand it a little bit more precisely, which I think will, you know, further inform the committee. What exactly was asked? Was it asked, you know, would you vote for yes to the same combined facilities, or a combined facility that had a different price to it or a different location? I want to understand that a little bit more.
Yeah, there were no costs or price associated with it. If the referendum were held today, how would you vote with the 5-point scale?
So would people's minds default to the last referendum then in doing that? Or was there any way for them to clarify just in the science of it, what would they be thinking in the way they were asked there?
Well, so I think many people would default to the last referendum, I think. And again, we looked at registered voters. It doesn't necessarily mean that they were the voters that voted.
Sure, because the last referendum basically was 5-3, percentage-wise, 60-40?
It was
60-40.
roughly 60-40.
Roughly 60-40.
Yeah. So, and what this says is that of the 60%, let's say, no's, in this sample, if it's representative, you know, only 22% of them are still stuck in no.
Right.
Everybody else has fresh eyes and they want to think about it again.
Is there-
Whatever's presented.
Well,
Go ahead.
I was just going to say, the intersection between how they voted and their future intent to vote is almost perfect. In other words, they haven't really changed in terms of their future voting intent relative to their previous voting intent.
Got it, thank you. So, to Pam's comment about the journey and bringing people along in the journey, I interpret the footnote that you gave in the notes and limitations section about that this was a sample of people who are already saying, okay, town, I want to communicate with you, you can communicate with me, I'm into this, all that kind of stuff. Is there thoughts as to, you know, along our overall journey, we're obviously going to try to engage as many people and as representative of the sample as we can. Are there thoughts about how to reach the people for this purpose outside of, you know, the ones who are currently registered, and the relative importance of doing that and what survey work can do for us? I'd get your professional opinion on that.
There's no way that we can go and, you know, back in history and find who these people are. We just know in aggregate, you know, how they voted. So
I'm asking something different.
Okay.
Let me restate.
Yeah. Go ahead.
So there's a third of the town said, or more than a third of the voting age basically says 8,600 people that you put up there.
Yeah.
That were, and then 3,500 down to 800, right, who answered the survey, rough numbers. 2/3 of the people, you know, like you said, there might be a self-selection bias for those who pay attention,
Yeah.
and so on and so forth. Are there survey methods that this committee should consider, you know, to reach the people who aren't on the town website that you would advise from your, you know, career would be wise to do and would, you know, be in line with the charge of this committee?
Yeah, There's no easy way. I mean, there are ways that you could drive people to take a survey if you mailed everyone in the town, you know, to direct them to a website that hosted a survey. We could, you know, talk about that as a possibility. But I think more importantly, it's really more of the messaging that you want to focus on going forward, and in particular, maybe heavying up on the things that are in that undecided group. You've already got the yeses; they're already on board. So the messaging that will resonate will be the messages that will resonate with the largest group will be the things that the undecideds are telling us in this study.
Right.
So
and one thing real
Yeah.
quick, and not to cut you off,
No.
but I think this might help, and I ask it of you all as the professionals. When and again, I've only been a consumer, being someone who was asking for these things to be generated and all.
Right.
The response rate that you all receive and the demographic breakdown, I'm looking at it and I'm just like, wow,
Yeah.
that is phenomenal. I mean, we can say within your art, right, that this is a pretty much a representative sampling of this town. Am I right or am
I don't disagree, but I'm obligated to put the caveat in there.
Of course,
Just to tell you
have
that,
to.
look, you're not, you know, don't be, you know, ordering equipment off this stuff, whatever. I'm always obligated to tell you, look,
No,
this
no.
has certain parameters for application, and this is.
Right, right.
But having said that, I'm really pleased with how the
Yeah.
age profile came out and how the voting percentages pretty much line up, you know, what are we at, 6 months later or whatever it is. I think that's pretty remarkable, and I don't think we even sent a reminder on this. I think we just did the
No,
one.
we did
send one reminder.
We did send a reminder.
Yeah, okay, I couldn't remember. But-
And when you talk about a broader scope, if you will, so part of the reason we chose this, one, I'm very data privacy oriented, and I wanted people who had opted into something that was close enough to this that I wasn't in any way invading their privacy or misusing their data.
Mhm.
We could do things on social, you know, you could post a QR link, you know, a QR code, you could do those kinds of things. It gets harder to track for duplication.
Mhm.
And so I wanted to make sure that we didn't have anybody filling it out more than once.
Mhm.
So that was important. So having a list electronically is the best way to go, but it really needs to be a list where they've previously opted in and it's been whitelisted so that it gets through to them and so
Right.
forth, is the
Right.
best way to go. But for more survey research, I think it may be worthwhile, as we hit the sort of 3 major pieces of our charge, to go out with a survey about needs assessment and to cultivate some kind of survey there potentially. And then again, when there's site evaluation options to look at, and to get feedback and course correct as we go.
Yeah.
The nice thing about the sort of the census approach with the postcard is you can assign a unique ID to everyone who gets a postcard.
Mhm.
And it can be truly unique, which is what Pam was talking about with the deduplication concern that we had. But you can, I mean, if any other method is, you're gonna introduce some form of self-selection bias, it just happens.
You will, but for looking for something that's directionally correct, this
Yeah.
is pretty darn
It
good.
is.
Right? I mean, and the postcard method and the barcodes on the postcards and all that is great, but it's also a lot more expensive.
Well, I was just gonna make that comment, I mean, this basically costs you nothing
Yeah.
to distribute.
And one thing, you know, there were things I think we've already learned. I'm sorry, somebody has a question.
Rob Camera, Acre Lane. So the postcard concept being used for deduplication doesn't help with households with multiple taxpayers, each of which could theoretically, or should theoretically, be able to, you know, have their own opinion.
Yeah.
So that also has that downfall, I just wanted to
Yeah.
point out.
No,
Yeah,
good
that to
point.
be individually addressed on a
Correct.
household level
Correct.
various, yeah. Is there anybody else who has a question?
I do.
Yep.
When we started talking as a committee, we were surmising what led to the defeat. And, one of the things we heard tons about was location. It's very, it's not showing up as distinct.
It's not, yeah,
Right.
it's not a top factor. It's gonna be important to the people who live next to where it's gonna go.
Of course.
And someone did respond that way in the open ends that I was going to share, basically said, I just don't want it next door.
case closed.
Got it.
Yeah.
There's always one.
And on an open-ended basis, with the open-ended comments that we looked at before, it also came up very, very low as a spontaneous comment. So it's affecting some people, obviously, but it's not gonna affect the majority.
It's good to optionality, right?
Yeah.
So, I wanted to understand that a little bit more. But I saw location, response times, it highly correlated to those who voted yes, and not to those who voted no. I just want to clarify, was it people saying that's not even a factor, or was that people saying we don't like the location, we don't like the response times, or was it?
I don't recall the location being, the groups didn't really discriminate on that particular,
Didn't seem
that
like it.
variable. It did discriminate on a better response time, better coordination, things of that nature. So the people who voted for, hypothetical referendum, clearly see the value and can extrapolate what the benefits will be. For the rest of the sample, especially the undecideds, they can't quite close the gap on it.
Yeah, so one of the verbatims that I mentioned was too expensive and location too close to my residence. Location and cost. Some were very simplistic. I support the combined facility. I believe that there are many efficiencies to be gained by having the groups in the same location, including shared overhead and better communication. Somebody else said the cost. The mill rate cannot continue to increase. I think we need a new police station for sure, and the plan is good, but the cost is too much, with 4 exclamation points.
So, a joint building was not an open-ended question, right? Like a combined building as opposed to separate, that was not a.
Well, we did have that one statement where people could express their agreement with whether they prefer 2 buildings at a higher cost, and that was rated very low.
Yeah.
Wow.
The open-ended
Yeah.
question, how is that framed again? Let me look to find that.
In terms of their rationale for
This one,
the way that they voted?
The
or-
open-ended,
Yeah,
how
it
you
was,
framed
please
that.
explain your rationale for the way you just answered that question. It's the one that followed the voting intent question.
Yeah, please briefly explain the main reasons for your position regarding, your position, whatever it was.
Right.
Regarding the combined police and emergency. So we were asking about the combined. Most of this was
Correct. Correct.
backward looking,
Correct.
with just a couple of things about, how steadfast are you in it?
Yep. Well, look, seeing where we are on the agenda, I mean, this is helpful. I think it's, more than helpful, it's essential. And it takes us from speculation as what we are, a bunch of residents, to really getting some data. So thank you both on outstanding work.
Great, thank you.
I
Great
have
job.
a feeling that we'll be hearing from you all again as we proceed, because this is a very efficient way to gather input from the community, so thank you. And with that, Pamela, unless you have anything else on this item, I'm prepared to close it. Is that okay? All right, so we're closing out agenda item number 3. Thank you very much, sir. Outstanding work.
Thank you.
Thank you.
Thank you.
Pleasure.